Yes, you can send them through now. No problem. Should have that paperwork through for you by the end of the day. Okay? No problem. Just send them through. Thanks so much. Alright. Yep, come in. Hi. Yes, it is. Good to see you. If you'd like to just pop yourself over here. No, you can leave, you'll go on or off, however you're most comfortable. Okay. So, you've popped along today because you're feeling a little bit under the weather. Okay. Now, had a little look at your records and I saw that it has been just over a year since we last saw you, so it's actually not a bad time that you've come in to see us. Okay, I do like to try to do an annual physical. Dependent on the symptoms, we may do, full or partial, but nothing invasive, don't worry, and just be, observing, you as you are now, and it will give you a chance to talk about anything that's bothering you. Sound okay? Perfect. Okay then, well, let's start by just making some notes. Okay, so right, I'm a little bit old-fashioned, I suppose, in my ways, that I like to chop things down rather than type them up. I agree. I think there's something nice. I mean, I have to transfer my paper notes onto the computer system, but it gives me a little chance still to not lose the art of writing. I think it's very important. Definitely. Okay, so why don't you start by describing to me your symptoms? Yeah, it doesn't matter how big or small, they all matter. Okay? Yep. And how long have you been getting the headaches? Okay. Have you always been someone who's experienced headaches in the past? And how would you describe your headaches? Would you say they come very occasionally? Do they come in clusters? When they come, do they, become so painful you have to lie down? Okay. Interesting. I couldn't see anything about migraines on your notes. Have you never mentioned it to us? No, okay. The symptoms you're describing are typical of those of a migraine, especially the kind of seeing little, they're known as floaters actually. Lights in front of your eyes, having to close your eyes and lay down, the feeling of nausea. It's all very common of migraines. Okay, right. Don't worry though, because there are ways to treat them. Okay. Can I just ask, do you wear glasses at all? Right, and when was the last time you went for an eye test? Okay. Well, part of the annual physical exam would be a little eye test, so I think we will definitely do that today. Not as advanced as you would get at the opticians or eye specialist, but still, it's something. I'll have a little closer look as well with my light. Okay, now you mentioned about pain around here. Do you find that goes hand in hand with the headaches? Sometimes. Okay. Do you suffer with pain sometimes around your teeth? Yeah? No, don't be silly. No, nothing serious. I think potentially you may have a little bit of a sinus infection. I can hear you're a little bit sniffly. Yeah, that can actually cause the headaches, can cause the pain in the teeth, around the nose area. They can come separately, but most people who suffer with sinus pain will also suffer with headaches. Okay, now I'm not saying it is that, but that's a possibility. Okay, I'll have a little feel of the facial areas to see if there's any inflammation there. Good. And any other areas that are bothering you? And whereabouts is that? Under here? Okay. How long have you felt unwell for? All of this together it's giving me a couple of different options. I'm either thinking the headaches could come from the need for glasses. Okay. Then when you mentioned the sinuses, I'm thinking potentially you do have either a problem with your sinuses. Now that can be a long-term problem. Some people do have that. Or you have more of an acute illness, in the way that this may just be a little infection, little cold sinus infection, and that would explain why you've got a bit of a sore throat and it feels a bit swollen. Yeah? Okay, good. Now, is there anything else at all? Are you sure? Okay, good. So we're going to leave it there for the notes for the time being. We can return to those, and if you've got any questions, I'll answer those at the end. Okay? So don't worry, you are in completely safe hands. Alright, let's put that just like that. So, give me a fresh pair of gloves. Now, I would normally be asking at this stage if you are allergic to latex because of the gloves, but these gloves are latex free. They are. You aren't anyway. So what I'd like to do first is I want to have a feel around the facial area and have a feel under the throat. Now, if you wouldn't mind, I will have to ask you to just remove your scarf for me. Thank you. You can just pop it beside you. That's fine. Lovely. Okay, right. Always happens when I put the gloves on. I need to adjust something. Anyway, right. So just relax. I'm just going to have a little look at your face. Okay. Now, what I would like you to do is I'd like you to just let me know if there are any areas that feel a little bit tender or sore. Okay, so let's start around here. Just that. Okay. Yeah. I'm sorry. Just be as gentle as I can. It's important that I do this. Okay. Okay, yeah. Just that, yeah. When was the last time you went for a dental checkup? Okay. Have you got all your wisdom teeth? Okay, there could potentially be a third branch. Potentially the pain in that area leads me to think you may need a visit to the dentist. Lots of pain, even headaches can be caused by pain in the wisdom teeth. It's very routine now to have them removed, so nothing scary there. Okay, right. If you're happy for me to do this, what I would like to do is I would actually like to just go inside the mouth, okay, and I'm just going to be feeling around the wisdom tooth area, and that will just help me to eliminate whether it is that or not. Is that okay? Yeah, these are nice sterile clean gloves. Okay, so I'm going to do this very carefully, so just open your mouth for me. Right, and I'm just going to press upwards. Yeah, nearly done. Pressing here, up, and here. Okay, sorry, and let's just try. Okay, sorry. Right, let me just change these gloves. Alright. Okay, so you felt a little bit of pain. Okay, so I would say the lower wisdom teeth potentially could be impacted. This is normally where the teeth grow inwards, or basically they grow this way and they prevent the other tooth fully being allowed to kind of breathe in a way. In that area it can cause the tooth to grind away. That can lead to infection. That could be why you're experiencing the pain. Okay. Yeah. Well, I can refer you to a dentist that I would recommend who does specialise in extractions. They also do cosmetic work and implants and things like this. Not that you would require that, but they are particularly skilled. Okay, lovely. Let's get those on. So, let's continue with the facial examination. Okay, so let's feel over this side. Okay. Just gonna feel under here. Do you still have your tonsils? Okay. Just like to ask in case, obviously, you have a throat infection, swelling, things like that. That can be the reason. Okay. So, yeah. Your glands are swollen, so you get glands under here, and typically speaking, when you have any type of really ear, nose or throat infection, we notice swelling in the gland area. So it can almost feel like a little ball. It can feel quite uncomfortable and can make swallowing quite difficult. So yours they're not very swollen, but they definitely are inflamed. As I was looking in your mouth there, I did notice some redness. Your tongue looks fine, but it would lead me to think that, you are a little bit under the weather. which is obviously how you feel, but now we can confirm that. Okay, so having felt around the facial area, I can detect some tenderness and some inflammation around this area, which would naturally indicate to me some type of sinus infection, inflammation, some type of sinus related issue. Okay, now the good news is that my first protocol would be to treat this with a sinus spray. Okay, now I can recommend some to you, and I'll do that at the end. Alright, but I think spray would be the way to tackle it first. They're very effective nowadays, very, very good. Again, a throat spray can actually help the throat. Drinking lots of cold water and fluids should also help to bring that down. You know, we are great believers in not giving out tablets and antibiotics, you know, just for the more common styles of colds and infections, because really they're not treated best like that. Okay, so it's best to go down the more simple routes, yet effective, but will definitely get you feeling better in no time. Okay, perfect. Right then, the next port of call is I would like to do a little eye examination with you. Is that okay? Wonderful. Let me take off my gloves for a moment. So you say the last time you went for an eye test was a few years ago. Okay. Do you do a lot of screen work for your job or leisure? Okay. I feel a bit dry. Okay. Do you use any types of drops at all? Alright, well let's have a look. I think the best thing to do is to take a look with the light first. Now this is going to be very bright, okay, I do warn you. So don't worry if you blink or may feel a little bit uncomfortable, but only be for literally a short amount of time. Okay, so you can either look at my nose or look behind me, but just thank you. Alright then, ready? Great. Okay, so what we're looking for here is any signs of redness, any sort of signs of yellowing, let's see. Okay, let's move it a little bit further back. Look about here. Okay. Okay. So the one thing I am noticing is I think your eyes do look a little bit bloodshot, a little bit red, okay? Now it's actually quite common when someone's not too well for their eyes to look a little bit yellowish, but normally when someone's eyes are more red, it would indicate to me maybe more irritation and dryness. So, right, we'll keep that in mind and we'll return to the light in a minute. But what I would like to do is a little eye test with you. Okay, so Are you familiar with one of these? Great. So, if you could please just cover one eye. Perfect. And let's start from the top then. Good. Third line. This line here. And this line here. And this letter. Okay, no. I'd rather you do it without straining. Okay, right, let's do the other eye then. Okay, we'll just change sides. Why not? So, coming over here and starting from the top. Okay, try this line. Good. Can you do the next line? This letter here. Okay, we'll stop there. Okay then. Let's place that back here. I'd like to try out these on you. Okay. So these are to detect how we see colours. Okay, so the aim is to detect the number within these coloured circles. Okay, so you can keep both eyes open for this. Alright, and we're just going to go along nice and easy and take your time. So you could just say out loud the number when you're ready. And here. And this one. And this one. And here. Okay, and this one. Alright, we'll just do the others. And again for me, exactly the same. Well done. Coming down here. Great. This one here. And this one here. Okay. Alright. I think it'd be helpful at this stage if I just made a couple of notes. Alright. So, eyes. So we had, yeah, 20, okay, strength in right eye, less than left, central redness, patient experiencing dryness, no self-medication, drops, the colour blindness tests, 100%, diagnosis would suggest eye examination, potential vision impairment, glasses required. Okay, right, so the good news is that your colour blindness was absolutely fine. Okay, so you do not have colour blindness, but the less good news is that I think it definitely would be time to visit an optician's. Okay, now I think whilst you do feel a bit under the weather, I think headaches can also be brought on by your eyes. Okay, so you mentioned about dryness, and I imagine you get that after extended screen use. Okay. Also, your vision on one eye is a little less than the other eye. Now, this can cause quite a strain because one eye is having to work harder than the other eye. So, I would say that you may need glasses just for up close work, or you may need just a quite what is the word I'm looking for? Prescription. A low prescription, just everyday wear glasses. Oh, bless you. I'm sure that you would look delightful in glasses. Well, there are always other options, contact lenses. Or should you choose to, then you could go down the laser option. However, your vision really isn't that bad. It's not. I just think that it could be putting a strain on your eyes, and that could be, not helping with the headaches anyway. Okay, right, let's pop this down again. So based on that, what I would just like to double check is a couple of things with the light. Okay, now what I'd like you to do is I'd like you to concentrate again on my nose. Is that alright? Great. I'm just going to be moving this backwards and forwards, alright, and then we're going to be doing a couple more vision tests. I just want to make sure that my recommendations that I send over to the eye place are, accurate. Okay, great. So I'm going to stand back a little bit. Alright, so thank you. You haven't got any chest pain, not coughing up any catarrh? No, I can hear your breathing sounds normal, so I would say this is an isolated issue. No, exactly. We have to be careful if it does go to the chest, so should that sore throat turn into a cough and a chesty cough, we must reassess. But at the moment, I think it's the start of a new year, and it's very common to get one of the germs that's always floating about. But as I say, we will have you feeling better in no time at all. Okay, good. Okay, so you do seem to be responding normally to the light, which is just what I wanted to check. I was really looking to check your pupil reactivity. Okay, good. So now another little test. So what I would like you to do is I would like you to tell me when my finger goes out of your vision. Okay, so again, look directly at me, or you may look behind me. You may look at this lovely poster. Alright, perfect. So you just give me a little nod, or you can say yes when it goes out of your field of vision. Okay, and starting now. Good. Good. Mm-hmm. 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 Okay, good. What I want to do now is I want to try it with both hands, okay? So, if you will please, same again. But only when they both go out of your field of vision, okay? Alright. Good. Just trying to catch you out there. Very good. 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 Just a couple more. Well done. Good. Okay. So, field of vision seems fine. What is leading me to think with your eyesight is potentially it really just is when you're doing close reading, you may be affected, looking at text, things like that. Okay? Based on that, could you have a go at reading anything from this poster? Yeah, it can be anything at all. Joints and movement, okay. Are you able to read, say, where the arrow is about the ankle joint? Okay, stop. What about, can you read the little white descriptions? Are you able to read the slightly greyed out descriptions underneath the white? Okay. No, that's fine. Alright, so let me just update my notes. But to be honest with you, that is really what I expected, so just wanted to confirm that. So, good. Confirmed. Visual tests. That was complete. We've done that one and we've done that one. Good. Lovely. So, okay. We mentioned about the sinuses. Okay. What I will do is I'll just send a quick call through to Liz at reception. She will just give you a leaflet which will give you a little bit of information about the recommended nose and throat sprays that can help soothe the pain. Okay, I'll do that in just a moment. In fact, I will do that now actually, and she can be getting them prepared while we finish off the other things. Bear with me. Hi Liz. Hi, are you able to get the nose and throat spray information sheet out? Yeah, Also maybe handy, I think we should have some of those leaflets left about screen work. Yeah, the one with the breaks. Yeah, that would be handy. I'm trying to think if there are any other ones I need. That would be perfect. Yeah, we shouldn't be too much longer. Okay, has the next appointment arrived? Oh, that's fine. Yeah, no, shouldn't be too much longer. Alright, but if you could have those ready. Perfect. Thanks, Liz. Alright. Okay. Alright, Liz will get those all prepared for you, so you'll be all set to take all that information home. Now, before you go, as you haven't been in a while, I do just need to assess your height and weight. Okay, so if you wouldn't mind just removing your shoes, please, and then I will get you on the height and the weight machine. Okay, thank you. It depends really on the strength of the infection. It could very easily be that the migraines are coming from your eyes. It could be that they are being increased by a little sinus infection and a problem with the wisdom teeth. So it's just really a process of elimination. Yeah, that's fine. Leave them there. Okay, stand up for me then. Right, so there is a little height thing, can you see? Yep, so if you just pull that down just over you, that's wonderful. Let me have a look. Alright, perfect. And now if you would like to just step on to the scales, please. Just write down your height. Okay, let me just, I did note down your height and your weight just for this check. Where did I write it? Oh, here we are. Okay, you'll be pleased to know you haven't shrunk. Alright, so let's have a look. Yeah, just relax. Okay, lovely. And step off the scales and you're welcome to put your shoes back on. Alright, so okay. So you're actually around a similar weight, which keeps you within a healthy BMI range, which is what we like. Good. Now in a moment I'll just discuss any medications that you're taking, and we can also discuss any other questions you have. Okay? Oh, perfect. Alright. So, just having a little look here. So, you are no longer on that medication for your back? No? Great. How's your back feeling? Good, I'm pleased. I can see here from the notes that last time you did come in you said there was a significant improvement. Good. Okay. Now you're not on any other form of medication. Are you taking anything on a regular basis that you're just buying? No? Okay, great. Are you experiencing any other form of pain anywhere else in the body? Good. Okay, and your bowel movements, I have to ask, are they normal? Great, regular? Good. Okay. Lovely. You're up to date with that. mentioned was about the eye drops. So I would recommend going for just a very basic dry eye drops. You can pick these up from a chemist very easily. They will just lubricate your eye. Use them 2 to 4 times a day or as needed. Especially I would say after screen work, pop them in, see if you find a difference. Okay. Recommended eye drops for the dry eyes, and that should help actually reduce the redness as well. On that note, actually, the redness in the eyes could be due to an allergy. Do you find yourself with an itchy throat, itchiness anywhere else? No. Okay, that's fine. Rules that out. Okay. Good. Well, you seem, apart from the fact that you don't feel brilliant, you still look generally well. Okay, still got that lovely smile. That's what I like. Okay, so I will do a little summary in a moment, but let's double check if you have any other questions. Yeah. Okay, so if the headaches don't go with you seeing the opticians, and they don't go with the sinus infection reducing, then you can come back and see me. Okay. Now the headaches, when they occur, you're saying it's mainly after long screen use, looking at your phone, things like that. So most of the time, and I can't say all the time, but most of the time, that is due to your vision. Okay, so I have glasses for everyday use, but I also have specific ones that have anti-glaring. They also have blue light protection when I'm looking at a screen, specifically to help reduce the headaches. So an optician will be able to recommend what's right for you, and as they will explain, you may experience headaches when you first start wearing the glasses because it's your eyes adapting, and you'll also have a prescription in there as well. So there will be an adjustment period. I would really say that's the main thing. You're not experiencing any other sort of signs of concern, I would say. As with the sinuses, you can get some medication specifically targeted to reduce sinus pain. Anything that reduces inflammation will be good, but again, I would say try the sprays, see how you go. It's all a bit of trial and error, but there are lots and lots of things out there that can help. Okay, but I wouldn't want to prescribe you antibiotics just for the sake of it. Okay, no problem. Now, is there anything else at all? Are you sure? Okay. Well, I would say that you're going to live to see another day. You're going to be fine. Let's go over the action plan. So you've been recommended some drops for your eyes, some sprays for your nose and throat. This under here, by the way, will reduce naturally just when you begin to notice a difference with your sinuses and your throat. Okay, so don't worry about that. You should notice an improvement over, a couple of days to a week. Okay, but you will be fine, I promise. Let's see, been recommended to the opticians. Great. I'm going to recommend you to a specialist one. Also, I want you to go and see this dentist. Great. These clinics are both within the hospital. Okay, we will select the closest one to you, don't worry, but they do have the most up-to-date equipment, so you'll be in good hands there. Okay. Treatments, no. Antibiotics. So, generally speaking, with the nose and throat, I would hope to see an improvement within a week. Okay, sinus infections can be quite difficult and stubborn, and some of them can take a few weeks, but if you manage them properly, you shouldn't be having too much pain all the time. Okay, so you should just see a natural reduction. All right. The headaches, as we say, they should improve with the glasses. All right. So that's good. And also, the sinuses do affect around the eye area. And when you do have some type of head cold or infection, it can naturally give you headaches. So, not totally unusual. Okay, good. Right. Happy? Yeah? Perfect. So you have a plan? Wonderful. Oh, you're very welcome. Come here. Alright. So if you head out to reception, as I say, Liz will have all those paperworks for you. Alright. Help making your choice a little bit easier when you're out and about for those sprays. Okay. She will also get the recommendations for the eye and also the teeth. Okay. Yep, I'll just give her a little call now. Alright, but you be heading out there. Not a problem. She will also book you in with a review appointment for 2 to 3 weeks' time. Okay? But feel free to come back and see me, should anything else occur. No problem. Alright then, well, enjoy the rest of your day. Oh, don't forget your scarf, by the way. Alright? Bye-bye then. Bye. Okay. Right. First off, we need to sanitize my hands. Good. Okay, right. Let's just pour this. Hi Claire. Oh yeah, is Liz busy? Oh, no worries. You'll have a patient coming out in a second. They'll have some leaflets on the desk for them. Yeah, could you just make sure Liz books an appointment for 2 to 3 weeks' time? Yeah, that will be a review appointment. Perfect. Now also, Liz needs to give the lost my train of thought. She needs to give the documents. There we go, documents, thank you. That contain the information about the eye and also the dentist specialists. Yep. They'll be able to book the appointments themselves. Yeah. Wonderful. Please make sure you pass that on. Oh, you're a star. Alright, thanks Claire. Say thanks to Liz as well. Alright. Oh, they're here? Yeah. Could you just give me 2 minutes? Yeah? Great. No, I'll just go and grab a drink. Okay. Alright, thanks. Bye. Okay, right. Just go and grab a drink. Let's dispose of those. Okay, good.